Hi, everybody. Welcome to the Academic Life and Emergency Medicine Book Club for April. This time around, we chose When Breath Becomes Air by Dr. Paul Kalanithi. This is a book that has been in the news, in the media, featured for many reasons, one of which, sadly, is that Dr. Kalanithi passed away actually, right before he was able to finish the book. The book is actually finished by his wife, Lucy Kalanithi, who's also a doctor. The book, I think, resonates with a lot of people, medical and non-medical, for a lot of reasons. And it, yet again, is another book about death that we have chosen to talk about in our book club. And I swear we don't like talking about death. However, there have been so many great books, especially by doctors, on this subject that it's been hard to ignore. And that's why we chose this to be our April book club. And today we have a great panel of speakers. So I am going to just get it started off with Brina. Brina Tyra, can you please talk about why this book resonated with you in general terms and why you chose to write the book club post that came out earlier in the month?
Thanks, and thanks for having me here in the discussion today. So I think that the reason why we've heard so much about this book recently and why all of our colleagues are talking about it is because it really does resonate with all of us as physicians. You know, this is someone who was in his last year of his neurosurgical residency. He had a huge promising career in front of him, and he had spent the greater part of 10 years preparing for this career, and suddenly has this diagnosis of metastatic cancer. And you know, this is someone who could be one of our colleagues, or it could be us. And so I think that that's why it touches us so much, is because we really relate to him.
Yeah, I think that it's the fact that he's such an average person, at least in our community, really does resonate with me. And I think, like you said, the point in his career that he gets the diagnosis right when he's finally about to finish residency and embark on what sounds like would have been an amazing career is when he's really struck with this diagnosis, and that's a pretty scary time. Does anyone else have anything to say about why the book club why the book selection resonated with you?
Sure. Oh,
go ahead.
One reason, I think that what you were saying about relatability is very true. And another part of it is I've often sort of been searching for the meaning of life. What is it? How do we find it? And that was one of his main goals as well. That's why he studied literature and then even neurosurgery, because he thought that's how he would finally figure out what it all means. And I think the process that you face when you're facing death is a very transformative process, and one that may elucidate this meaning more than any other experience. And even though we'll all face that at some point, I'm not ready to face that now, and so it's nice to learn from his journey and his experience at this early stage in my life. And I think it also helps us relate to patients when they're facing death or their family members, after sort of seeing his experience, as he puts it, what lies up ahead on the road. It can help us guide our patients a lot better as well.
Yeah, Melody, I completely agree. I think that theme of finding the meaning that kind of runs throughout the book really resonated with me. And I had been really interested in this topic in the context of people I have heard speak who talk about when you find the meaning in your career, it really enhances the career satisfaction and makes your career more of a calling than just a job. And I found it interesting how he kind of had that perspective before his diagnosis, and then when he was diagnosed, one of the main things he struggled with his oncologist was that she kept telling him to try to find your values, find what has the most meaning for you. And so watching the way that shifted from his kind of definition as a physician to then his kind of whole definition as a person facing the end of his life, to me was just really thought-provoking and interesting.
Mm-hmm. And I think that the role of his oncologist in his writing is really important for us to see as well, because she played a a really nice role in helping to guide him, throughout his diagnosis, not just in guiding his treatment, but actually guiding him in dealing with the transition to being a patient and helping him to find his values. And I think, she really, in this book, is kind of could be a role model for all of us in, helping to guide our patients as well.
I think it also gets to an interesting point of what's your meaning as a person? And if you spend 10 plus years training to be a doctor, that does at some point become an integral part of who you are as a person. But if you're faced with your own mortality, is that really so important? And early in his diagnosis, it was important to him, and he worked really hard to get back into the operating room. And I confess, as a reader, I was thinking, is this really the right decision? Your hands are so shaky. Are you sure you want to be operating on someone's brain? But he did it. He did it well, and it meant so much to him. But the second time when the cancer came back, it wasn't so meaningful to him. And I wonder, for myself, in a job that's a little less skill required, would I push so hard to be in the emergency department, or would I push so hard to be with my family? And I don't know necessarily what the right answer would be. And obviously this is not the same thing as dying, but I'm about to have a baby, and I am trying to think about how much time do I want to take for maternity leave. I have the option of taking a lot of time off, but then I thought, well, what about all this awesome stuff I'm doing at work? I'm going to miss out on that. And I told my husband this, and I think he was pretty appalled by my reflection. And he thought, if you can take all the time, why wouldn't you? So just something to think about.
Yeah. Well, I think that's why this book also makes us think about all these general questions related to physician wellness as well, that the work-life balance, the balance between, investing for the future versus enjoying the present. These are constant questions that we have to face as physicians, and, whether it is having a baby or being faced with an illness, all of these significant life events bring those questions more to the forefront.
All right, let's move on to Melody. You're about to graduate from residency. You are a chief resident, so congratulations on that, similar to the author. What about this book, did anything strike you in particular because about this transitional point you're about to face in your life?
It definitely did. It made me identify a lot more with where he was when he described being at the top of the mountain and being able to see his future finally as he had planned it, laying out ahead of him. Speaking about having a boat with Lucy and their hypothetical or theoretical children out on it, that did resonate a lot. And I've often wondered if faced with some illness or some big life event, if I would continue on with residency. Partially because I've grappled with this idea of enjoying the moment, living here now, because this could be your last day, versus the extremely delayed gratification of residency and training. And that starkness becomes even more apparent on our very difficult rotations, the ones that are time-consuming, mentally and emotionally draining. It becomes even more difficult to see why you're doing this and putting yourself through this. But so before reading this book, I thought that if I had some illness, I'd probably leave residency, go do something else. I don't know what exactly. But after reading this book, I realized that being a physician has become such an integral part of who I am and part of my identity in a way that I could never have predicted when I started medical school. And my clinical work has such a huge, it's so wrapped up in my meaningful work, my purpose. I sort of had this feeling that I have a moral obligation to work as a physician now. So it brings so much meaning to my life that I don't think that I could leave anymore. I don't think it would be a meaningful experience to leave. So I'm very thankful for his reflection, because it sort of shined a light or a mirror into these aspects of my life that I was sort of confused about. And now I feel like I would definitely want to finish.
What about Lady Marina? So you've been graduating from residency, out and working. Now that you've had a taste for what real clinical life is like, which is maybe not so glamorous as we thought, would you be so willing to leave if given this type of diagnosis?
I think that's a really tough question, hypothetically. But I agree in that, being a physician and kind of the work that we're doing, we really start to integrate that into who we are. But I mean, we're also socialized to do so. If you think about, how did you prepare for your residency interviews, or how did you prepare for your job interviews for your first job as an attending, practice in your mind your elevator speech. This is who I am. This is what I want to do, and that's what gets you to the next step. And as a junior faculty member in particular, you're always selling yourself to, like, I am a researcher. This is my area of focus, and you practice this. You write this over and over again, and so to then have to think after polishing that elevator speech and your personal mission statement over the course of so many years, to have to rethink the whole thing, based on an illness, I think that's a very difficult thing to have to face. So I think it's tough, but I can understand, that is also part of what would make you want to go back, is that you really have internalized that, that personal mission statement that you've polished over so many years.
And Lainey, you're a program director. Did this book give you a different perspective? Would you counsel residents, or when you talk to them about life after residency?
Yeah, that's a great question. I mean, I think that when we all have experiences like this, where we hear about a diagnosis or we hear somebody's story, I think my personal opinion is that I have this sense of, if that ever were to happen to me, I would want to hope that I had kind of thought about it in advance, so it's not like when that diagnosis happens, you have all of these regrets about the choices you've made and the way that you've lived your life. And I do talk to our residents a lot about the fact that residency is really important, but it's one stage in your life, and it's really important to nurture the things that have meaning to you now and find balance. And I think that reading this book, reading this perspective, just really kind of drives that message home. So I definitely would encourage all residents, all fellows, all faculty to read the book and kind of take a step back and take stock of the choices that you're making in your own life, and just make sure that it feels right to you. And if you found out that you only had a certain amount of time to live, would you still be spending your moments the same way that you're spending them right now?
Mm-hmm.
Okay, let's move on to question 1. So Brina and Melody wrote a blog post for the book club, and there were a series of questions at the bottom of it. And I'm going to turn question 1 over to Lainey to reflect upon and answer.
So we've already kind of mentioned that one of the themes of the book is Dr. Kalanithi's search for meaning in his career and kind of throughout his life. And he talks a lot in the first part of the book, which is really kind of his development as a person and as a physician and as a surgeon, about how it was really important to him to kind of understand death and become really close to the patient experience of death, because he really tied that to his definition of meaning. And then he talks about how that his understanding of that kind of changed throughout his residency. And I'm just going to read a part of a quote from pages 181 to 82 in the book. He says, "I was not yet with patients in their pivotal moments. I was merely at those pivotal moments. I observed a lot of suffering. Worse, I became inured to it. Drowning, even in blood, one adapts, learns to float, to swim, even to enjoy life, bonding with the nurses, doctors, and others who are clinging to the same raft, caught in the same tide." And the adaptation that he's talking about, the way we become really kind of used to all of the chaos and all of the really wonderful and tragic things that we see in the emergency department or in all of our careers, is, I think, a very common physician experience. And so the question is really, what can we do to avoid becoming overly adapted so that we lose touch with that patient experience? And I think from my personal experience, the times when I'm really drawn back to this is what it's like to go through one of these experiences and to be a patient, is when I'm a patient or my family members are a patient, and just it really brings you back to, like, wow, we do this every single day, but you forget how vulnerable, how complex, how confusing it is on the other side of the patient-physician experience. But I think the trick is really asking ourselves, how can we get drawn back to those moments when we're fortunate enough to not have to be a patient or to be well and kind of have a long period of time where we do become inured to it. So I'm curious to what tricks or ideas you guys have to how you can kind of have periodic reminders to stay grounded in that patient experience.
How about Brina?
So, I think it's interesting. I definitely feel that, I thought more about this question as a resident in the beginning of my training, and that, as the years go on, you definitely become more accustomed to it. But I think that, not only in the big, tragic cases that stand out in your mind, but even in day-to-day emergency medicine, to really engage with the patient and ask them something about themselves, and to return to that humanity of each patient. It not only reminds you that that they are a person that you're caring for and not just an abdominal pain, but also makes your whole your day and your clinical shift more interesting and more engaging. And I think that at least for me, that's one of the mechanisms also to prevent burnout, because I think that really engaging with your patients, and they have a lot of interesting things to say, and you find out a lot of interesting things about people, and it really keeps you going. And I think that they appreciate it as well, that you take the time to speak with them more and find out something more about their life.
Yeah, I think you're absolutely right. What he wrote, that paragraph, is pretty much the stock definition of burnout, and trying to battle that has become very important nationally, but because it's such an integral part of being a whole and well person. Melody, what do you think about that question?
I think it is easy to forget that the patient's a real person, especially when you're feeling burned out. So I think strategies to reduce burnout are extremely important in residencies. And I think there's a role for narrative medicine here as well. If you are writing from the perspective of a patient, if that's one of your exercises in your narrative medicine class, for example, that might help you sort of feel those moments of empathy and remember that this is an actual person. Similarly, if you have to write about your own experiences, maybe you can better understand how burnout is affecting you and shaping your day-to-day experiences, and then maybe take some steps towards wellness to prevent it. But I think identifying it is a huge step, and writing might help people do that.
I wonder also, as a doctor, I understand how burnout happens, and I'm sure all of you understand that also. But I wonder if the general public understands how that's possible. And I wonder if they were to know that as an emergency medicine doctor or as a neurosurgeon, how can you possibly be used to the fact that someone comes in bloodied, banged up after they've been shot in the brain or in a massive car accident, when you use common language to describe what we see as opposed to the medical jargon, it paints a horrifying picture. These are the things that scary movies are made out of and scary stories are told of, and yet we are so blasé about it. And so I wonder how to explain to the general public why this happens, when the reality is it is a very gory thing, but it becomes so commonplace. I don't know. I struggle with that. Okay, let's see. So I wanted to then talk about question 6. So question 6 in the book club was the fact that we had already talked about a little bit, Dr. Kalanithi's difficulty transitioning from a physician to a patient. And the question itself talks about how it was an extremely difficult transition to being from a position of power to one of complete reliance. And there is a particular scene that the question reflects upon in the book where Dr. Kalanithi is a patient in the hospital and has to deal with the overnight resident on call. The overnight resident is obviously a highly functional doctor, but not necessarily someone who knows Dr. Kalanithi or has been involved with his care up until this point. And they had an argument over whether or not Dr. Kalanithi needed to have a drug at that moment. And this conversation is a funny conversation because it's one I feel like I have with my patients very frequently. And I very frequently give the same answer that the resident gives, which is, don't worry about that right now. We'll let the morning team sort out all your medications. But this medication in particular, Dr. Kalanithi felt very strongly about. He was in this trial for this experimental drug for his cancer, and he felt like he needed it that night to prevent him from relapsing. And the fact that it was not ordered, despite the fact that he called the resident to his room multiple times, talked to him face to face, the resident even at one point said he would actually order it, still did not order it, really infuriated Dr. Kalanithi until the resident made a point that maybe this drug is actually what is making you sick. I think that when I read the question, I understood why the resident did it from a medical perspective, because that is something that I often do myself, especially for medications like high blood pressure or diabetes when the vitals and the blood work are normal. But from the patient perspective, I can understand he's grasping and fighting for his life, and he feels that this drug is the most important thing at that moment to keep him fighting and in the battle, and to not get this medication because of someone who doesn't understand his illness infuriates him. And that must be what a lot of patients deal with. And I don't know how the right answer is. Could the resident have expressed more empathy for the patient? Maybe, but maybe in his mind he had expressed empathy. He went into the room at least twice. I don't know how busy he was that night. And so probably more than anything, this conversation reflects a disconnect. And I bet if you were to talk to that doctor, that resident, he would have felt that he was trying to do his best, was showing empathy, was caring for the patient as needed. But if you were to ask Dr. Kalanithi, it would be the complete opposite. So how can we real-time discover these disconnects and intervene on them real-time? That would I probably think be the key to stopping a lot of these misinteractions. Go ahead, Rena.
So, I think that this happens in a lot of situations. I'm sure we've all had the experience, even if not for ourselves, but being by the bedside of a family member. And, at that point, you don't necessarily want to have your medical thinking cap on, but you can't help it, and you want to advocate for them. And it really makes you think also about those patients who can't advocate for themselves as well, and what goes on with them. But I think in this particular case, though, it's probably just a disconnect in the way that they're thinking. And so one of my mentors at Stony Brook used to say to me, if you're having any type of problem or you're not on the same page with the patient, that's the room that you should spend the most time in. Right? Meaning that if you sit down and really spend the time, actually sit down in the room, not just stand, but sit down in the room and really try to connect to that patient to understand their perspective of the situation, even if, you're not planning to do what the patient wants at that moment, at least you understand, you can empathize a little bit more, and it might change your perspective on what you're thinking. So I think a little bit, deeper dialogue or more concern on the resident's part may have helped that situation.
Yeah, I think that really speaks to the conflict that we find ourselves in when we get a little bit caught up in our version of we are trying to help this person medically, this is the right thing to do for them medically, versus their version of wanting comfort or wanting their fears to be recognized or just wanting to feel better. And kind of being mindful of that, I think when we're in these situations of taking a step back and letting go of what we think is the right thing and trying to figure out what is actually going to bring them some peace or some healing or bring them wellness, because we know that despite the fact that we have a lot of ability to actually intervene and change the course of illness and disease in the emergency department, it's still relatively small amount of patients where we're making a tremendous difference. Usually they come to the emergency department because they have concerns and they want to feel better, and it's oftentimes kind of addressing those concerns rather than the medical treatments that's going to truly be effective in that. So balancing that need with our kind of medical model need to cure or to halt illness, I think is helpful.
What do you think, Melody?
I agree with everything that has been said, and I think that this vignette also illustrates the transition from physician in control in this position of power to patient, where you're very vulnerable. I think you want more of these comfort moments, and I don't know what the answer is. I can see that if I were in this position, it would be very difficult to hand off your sense of control. So I don't really have an answer. I think it'd be very difficult to be facing illness when you're used to being the one who's sort of making the decisions.
I think so. And we're about to get to the conclusion of this discussion. So if anyone has any last things they want to say, the one thing that I wanted to say was I feel like, going back to the original question of why this book resonated with you, I think generally speaking why I think this book resonates with the general public is that it is so beautifully written. And for a first-time author, a doctor no less, who doesn't have too much formal training in writing, it was such a surprising read. It was so heavy on philosophy, heavy on literature, references to books that I had never heard of. I tried looking up and turned out they had been written in the 18th century. This book is so rich on so many levels that it goes beyond your typical reflection on a person who's dying. And I think that's why this book is so powerful. And then, of course, the fact that it was such a young person's life taken away at an early age. And I'm really glad that I did end up reading this book. And it was a good reflection. I'm glad I read it in Hawaii so I could have the sunshine to make some of the sadness go away. Does anyone else have any last things they want to say? I'll start with Sabrina.
I agree. It's just a beautifully written book. I mean, it really, is a window into the insight that he had, and I just think that he was a very extraordinary person in terms of both, his medical ability, but then also just his ability to verbalize all of these kind of thoughts that, we all have, but, kind of take it to the next level and really express some of these thoughts about medicine and being a doctor in a way that, is really eloquent.
Lainey, how about you? Any last thoughts?
I think two additional aspects of the writing that were so powerful for me were how honest and vulnerable he was throughout the book. It was a very real picture. And not only the author, but also his wife. I think the fact that the book kind of ended kind of in the middle of his story, but really kind of right at the crux of his story. And then his wife picked up and painted the picture for us of what happened. And her writing is also beautiful and raw and vulnerable and honest. And actually, I think for me, the most moving part of the book was in the epilogue where his wife actually illustrates what it was like when he actually died. And I think it was such an emotional and difficult thing to read, but also so moving. And I think for any of us to just read those few pages and kind of get a glimpse of this is what it really is like when you're sitting with a loved one as they're breathing their last breaths, I think was incredibly powerful. I think it is important for all of us as physicians who deal with death on like a day-by-day basis in our shifts to just have that insight and think about it a little bit. So I wanted to really commend, both him and his wife for being so vulnerable and in order to give us the true experience of what they were going through.
Agreed. And I think that another reason why this narrative is so powerful is that Dr. Kalanithi is such a skillful author in describing his experience in a way that almost anybody can identify, I think. And I think that's what makes one person's autobiography or a narrative so much more powerful than somebody else's, is the ability for the general public to identify with this person and learn their lessons through them.
Well, and that concludes this book club. Thank you so much for joining us. Thank you so much. We had Dr. Brina Tyra, Dr. Lainey Yaris, and Dr. Melody Glenn who joined us. Next month, we're actually going to take an even more controversial book, book that will make you food to think about, which is Lean In by Sheryl Sandberg. So if you want to join us, let us know about that. And then, until then, thank you so much for joining us. Take care. Bye-bye.